Assalamualaikum and selamat sejahtera to our lecturer, Dr. Wan Mahani Hafizul binti Wan Mahmud. My name is NORSHAFIQAH binti S.ROSELEE. My method number is CE19039. So today I will explain computer tomography.
Hi, Assalamualaikum. My name is NURDANIA IRISHA binti ROSLI, method number CE19024. Our summary for the part 45A, which is the basic principle of computer tomography. There are several indications for performing CT-based assessments such as assessing cerebral vascular disease, cerebral hemorrhage, synopsis, pulmonary embolism, aortic asphyxiation, fractures, and many cancers. CT has proper end limits, including the risk of ionizing radiation exposure and the possibility of misdiagnosis of some disorder. CT gives higher delineation of fine bone detail, magnetic resonance imaging, which is the MRI, provide better soft tissue contrast than CT. For example, in the detection of brain metastasis from small cell lung cancer, MRI with contrast is more sensitive than CT contrast. The introduction of sleep technology, which provide continuous electrical supply to the revolving gantry without the use of permanent connection. This is to eliminate the time necessary for breaking and reversal of spool cables, enable the development of the faster helical, which is the spiral of volume CT, which offer greater spatial and temporal resolution. The radiation exposure is a significant cost. Strategy include the getting only the necessary CT scan and modifying the scan based on the scan indication, agent expected, and patient size. This initiative must be supplemented with effort by manufacturer to create and deeper radiation dose management technology, as well as effort in research, education, and CT standard and regulation. Next, I will present for the summary for the 5B, which is the clinical application of computed tomography. First, for the brainstem gliomas, an area of the brain that is connected to the spinal cord is referred to as the brainstem. This illness may be difficult to identify in its early stage due to the inaccessible position of the glioma and its sometimes insidious progression. To identify childhood brainstem gliomas, computed tomography is used to examine the brain. Computed tomography scan produces a series of detailed images of parts of the body taken from various angles. A computer coupled to an X-ray machine create the image to make the organ or tissue more visible. A dye may injected into a vein or ingested. Next, for the pulmonary disease, on CT scan, normal lung tissue has a dark appearance, however not quite as dark as the air that is contained within the lungs. When a local lesion or nodule is seen on a planar X-ray, a CT scan is often carried out as follow-up procedure. A CT scan may provide a much clearer picture on the lesion size, shape, uptake of the injected iodinated contrast agent, and classification status. Next, for the brain scan, computed tomography is used to diagnose both chronic and acute brain injuries. A brain scan CT involves the X-ray beam moving around the body in a circle to obtain several distinct images of the brain. The data is transferred to a computer which analyzes it and shows it on a monitor in 2D form. Brain scan may be performed with or without contrast. Contrast refers to a chemical taken orally or injected into the IV line that causes the specific organ or tissue under examination to be viewed more clearly. Next, for the urinary tract imaging, a computed tomography is used to analyze the urinary tract imaging of the injection of contrast light into a vein. Before administering contrast, plain CT urography, which is the CTU, without contrast is used to assess stone disorder classification inside the kidneys, density of renal masses, and presence of any bleeding. A CT scan is important currently to examine any strictures or masses inside the ureterus or from outside but compressing on the ureterus. For the 5C summary, which is the application of deep learning in computed tomography. Deep learning is a form of machine learning that allows computational models to learn data representation with various levels of abstraction using various layers of processing. CT scan uses a motorized X-ray source that rotates around a round opening of a donut-shaped structure. It is called a gantry. Each time the X-ray source completes a full rotation, CT on a computer uses sophisticated mathematical technique to construct two-dimensional image pieces on the patient. The thickness on the tissue shown on each piece of image varies depending on the CT image used at the time. The X-ray scan process is then repeated to obtain the image result. This process will continue until the number of the slides can be collected. So for the deep learning method, various methods can be used to create strong deep learning method. This technique included the learning rate decay, transfer learning, training from scratch. For the learning rate decay, learning rate is a hyperfactor parameter that is defined a system or set the condition for its operation before the learning process, and it can control how much change the model undergoes in response to the estimated error each time the model weights change. Then the transfer learning. This process involves the completion of a previously trained model. Once those adjustments are made on the network, new tasks can be performed with more specific categorized abilities. Training from scratch. This method requires a developer to collect a large level dataset and configure a network architecture that can learn the future and model.
So I will explain a definition of CT scan deep learning. A procedure that uses a computer linked to an X-ray machine to make a series of detailed pictures of area inside the body. The pictures are taken from a different angle and are used to create a three-dimensional 3D view of tissue and organ. Then may be injected into a vein or swallow to help the tissue and organ show up more clearly. A computer tomography scan may be used to help a diagnosis disease, plan treatment, or find out how the treatment is working. Also called CT scan, computerized axial tomography scan, computerized tomography, and CT scan. Next is a principle of deep learning. Computer tomography CT image are depiction of relative attenuation of X-ray as they pass through a body. CT image are depict tissue density. Tissue CT attenuation ability is related to its density and represent a likelihood that an X-ray photo will pass through the tissue to be recorded by the detector rather than interacting with tissue atom. Absorption of the X-ray into the tissue, which is prevent the photo from reaching the detector or at all. A particular tissue X-ray attenuation ability is expressed by its attenuation of coefficient micro. Next is a concept of CT scan deep learning. The concept of CT scan, which is related to a deep learning, is that we can undergo a CT scan in hospital or outpatient facility. The CT scan is usually not painful and will never mission only take a few minutes. For the whole process, this usually take 30 minutes. So for during procedure CT scan, shaped like a large donut standing on its side, rope and pillow can be used to help a patient stay in position. Head of the table may be fitted a special swing that will hold the patient. During the scan, the head of the table may be fitted as maybe swing that will hold the patient. After the scheduled transfer patient into a scanner, the detector of X-ray should rotate around the patient. At each rotation will produce several images of the patient. So the technology in separate room can also see all the movement of the patient. Patient can also communicate with a technology via intercom. So after the procedure CT scan, patient can return to a normal routine. So in half cases, the patient may be asked to wait for a while before leaving to ensure that patient feel well after the examination. So next is advantage and disadvantage of deep learning of CT scan. So by applying a deep learning model to a standard CT scan could generate a higher quality image, enable provide to extract a better insight and improve a diagnosis. So first is a high resolution CT. This type of CT scan use a very thin slice less than 0.1 inch, which are effective in provide a greater detail in certain conditions such as lung disease. Next is a helical or spiral CT. During this type of CT scan, both the patient and the X-ray beam move continuously with the X-ray beam circle the patient. The image are obtained much more quickly than with a standard CT scan. The result of image have greater resolution, contrast provide a more detailed information. So maybe helical CT scanner may be used to obtain information about calcium build up inside the coronary arteries of heart. Next is ultra fast CT. Ultra fast CT also called electron beam CT. This type of CT can produce image very rapidly. Thus, a creating type of moving parts of the body, such as the chamber and valves of the heart. So this scan may be also used to obtain information about a calcium build-up inside the coronary arteries of the heart, but the helical scanner are much more common. Next is a computed tomography angiography. So angiography or arteriography is an X-ray image of the blood vessel. A CT angiogram use a CT technology rather than standard X-ray of a fluoroscopy to obtain an image of blood vessel. Such example, the coronary arteries of the heart. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is NURDANIA SYUKRI. My matric number is TE10151115. So today I'm going to be explaining about question number 5 and 6. As a conclusion for the application of deep learning, it has been used in radiology as it has the opportunity to provide better image interpretation and diagnosis accuracy, and it also used in chest imaging as there have been many efforts to develop and use computer-assisted detection system to detect lung nodules. Next, it is also used in nodule detection as the patient will gives or gets outcomes where it is addressed with an deep learning approach. For question number 6, CT scan and other application. Other application of CT scan is it can be used to obtain and scans the severity for SARS-CoV-2 or also known as COVID-19, as it is helpful to diagnose COVID-19 in individuals with high clinical suspicion of infection. The process is by processing the CT scan images with a deep learning model and use a radiologist report, and then this data will be integrated using clinical and biological data, and the results will show and it predicts the severity of COVID-19 among the patients.
Assalamualaikum warahmatullahi wabarakatuh. My name is FARAHAN bin SHAH. Matric number DE190130, and I will be answering question number 7 and question number 8. For question number 7, which is the future challenges. Firstly, computed tomography (CT) states the essential imaging procedure for intense cranial injury. However, for most other cerebral applications, MRI has supplanted CT. Secondly, CT discovery of uncertain injuries, including lung carcinoma, is simple. Nonetheless, the procedure requires longer and additional tedious CT picture understanding. Thirdly, is the determination of standardized treatment for CT detection lesion. And lastly, the needs for detection and diagnostic criteria. The pre-existing inflammatory lesion and varying histologic subtypes result in a multitude of CT findings that may be difficult to interpret. Next is the question number 8. To answer the question number 8 is the future perspective. The multi-site CT, with its speed, furthermore, ability of multiplanary formats can be substituted for MRI in few clinical circumstances. Yet, assuming MRI is shown as the principal line examination, that this is preferably in light of the absence of ionizing radiation. Secondly, is the development of diagnostic support system using computers. Thirdly, need to develop less invasive therapeutic modalities. CT screening conceivably will detect very early stage tumors in wider varieties of patients, including those with previous lung resection for malignant disease, patients with compromised pulmonary functions, and elderly patients. Lastly, extra endeavors are expected to foster clinical suitable picture recreation methods that give exact, accurate quantitative assessment of pressure circulation, free of component size, shape, and area. That's all from us. Thank you.